Osteoarthritis. In this section, we shall be looking at the condition known as osteoarthritis, which is one of the conditions that affects elderly people and also a non-communicable disease. But before we move into osteoarthritis proper, we shall look at arthritis. Arthritis is inflammation of one or more of the joints, like the knee joint, the elbow joint, and the interphalangeal joints, and any other joints of the body. Arthritis, which we said is an inflammation of one or more joint, means that it presents with the classical signs of inflammation known as pain, redness, loss of function, and rubor. So arthritis presents with pain, swelling, and stiffness. These are the characteristic symptoms that is peculiar with all arthritis-related condition. It is important to say that any joint in the body can be affected by arthritis, as we're going to see when we move into the pathological part of this condition. Like we said, osteoarthritis is by far the most common form of arthritis and is a major cause of pain and disability in older people. It is characterized by a focal loss of articular cartilage. That is what is known as articular cartilage. If you look at this, this is articular cartilage here. These are articular cartilages here. So it is the loss of articular cartilage, subchondral osteosclerosis, osteophyte formation at the joint margin, and with a characteristic remodeling of the joint shape. And it's well known by enlargement of the affected joint. What all this is talking about, that osteoarthritis is an inflammatory condition, like we said, and it leads to the degradation, that is a destruction of the articular surface, such as those cartilages that are in the surface that allow free movement in the joint. So it leads to its destruction and formation of osteophytes, and that osteophyte makes it the joint not to move freely, and the joint margin is lost, and then the remodeling, the formation of a type of joint that is that will not allow a very good movement in that joint, and the shape of that joint will automatically change. So that is what you need to know about osteoarthritis. It's a degenerative condition, destruction of the articular surface. Now let's look at the joints proper, because if we don't have a good understanding of the joints, we may find it very difficult to flow in this section. Now let's look at the joint. These are a perfect example of a joint and the parts of a joint. Now let's look at it one after the other. The first we're going to look at is the bursa. Look at the bursa here. What's the function of the bursa? The bursa are small fluid-filled sac located between the bones and soft tissues. It's usually found around the joints. And what is the main function of the bursa? Is to reduce friction and cushion pressure points between the bones and tendons or muscles, allowing for smooth movement. So also the bursa helps to absorb shock and can protect against inflammation and damage. If you look at here, this is the bursa. What does it do? Because if pressure is applied here, it prevents friction between this muscle and this bone. This is a muscle and this is a tendon. So this is the muscle now. And look at the bursa found here. You see. So it helps to prevent friction between the muscle and this. That's the first function. Then it serves as a pad that absorbs pressure. If a pressure is applied here now on this muscle, this bursa will have to cushion the effect of that pressure. So it cushions the pressure. Then it cushions the pressure between the muscle. Look at muscles and this structure. Tendon. Look at this is the tendon now. It also cushions the pressure between the tendon and the underlying structure. As such, it allows for a smooth movement. That's the boson. And diseases that affect this leads to bursitis. Now, another part of the joint is the epiphysis. Epiphysis. Look at the epiphysis. Epiphysis means the end segment of the bone. This is the end segment of this bone now. The end segment of this bone. And it is covered with articular cartilage. Now, you recall when I was making introduction, I told you that osteoarthritis is the destruction of the articular surface, as such, preventing a smooth movement. Look at this. This is called the articular surface. It includes articular cartilages and other stuff. So with this articular surface, it allows for free movement because look at the synovial fluid. So this joint can easily move without one rubbing against the other. But osteoarthritis causes destruction of this smooth surface here. Okay, so the primary function of this epiphysis is one, it helps to distribute weight and stress across the joint during movement. This is the bone that's carrying you. So it helps to distribute the weight of the body along this margin. Then it ensures joint stability. It ensures joint stability. Without this epiphysis, there will not be stability because it's the weight-bearing part of the body of this whole structure here is the bone. So it ensures joint stability. Without this epiphysis, there will not be attachment for most of all this structure. So it helps in joint stability. Then growth of individuals occur at this epiphyseal plate. We call this epiphyseal plate. This is where the growth of bones occur. So therefore, epiphysis is necessary for growth and development until a person is above adolescence. When epiphyseal plates ossify, it stops, growth stops. Okay, so that's another structure in this joint is the enthesis. Enthesis. This is known as the enthesis. What's the function of the enthesis? The enthesis is the site where a tendon, this is a tendon here. This is a tendon, this is a tendon. This is a tendon where it attaches to the bone. Where it attaches to the bone is known as enthesis. So this is a perfect example of a tendon attaching to the bone via the enthesis. And this is a perfect example of ligaments attaching to the bone via the enthesis. So the enthesis is very important because it provides the opportunity for attachment of the ligaments or tendons to the bone. So what is the function of this structure? One, force transmission. It effectively transfers forces generated by the muscle to the bone. So that's the function. This muscle now, all the forces it's generating is being transferred to this bone through the help of this enthesis. Then it's also assists in shock absorption. It helps in absorbing stress and strain to prevent damage to the bone and surrounding structure. So that's one of the functions of this enthesis. Another structure here is the articular cartilage, like I've showed you. The articular cartilage is a smooth, slippery tissue that covers the surface of the bone within the joint. See, this is known as the articular cartilage. It covers the surface of this bone. And what's the main function? It allows for smooth movement, like I said, reducing friction between this bone and the other bone. But osteoarthritis leads to its destructions, therefore allowing these two bones to rub against each other. It also does the function of shock absorption. Articular cartilage helps absorb impact and distribute load during activity. So with the bone bearing the weight down, it helps to distribute it along the bone. Then it also provides support to the joints. Okay, so these are the major functions of the articular cartilage. Another structure here is the tendons. And look at the tendon. This is known as the tendon. The tendon are strong, fibrous connective tissues that connect muscles to the bone. This is the muscle here. Muscle starts and ends here. Tendon connects the muscle to the bone with the help of the enthesis. What's the function of the tendon? Force transmission. The tendons play a crucial role in transmitting muscular forces to the muscular system, which leads to movement. You cannot move if the tendon do not transfer the force the muscle is generating to the bone, thereby drawing the bone forward or backward. Then the tendon also are elastic and flexible. So this allows for flexibility and movement of what? The joint. Another structure is the joint capsule. Look at what's known as joint capsule. From here to here is the joint capsule. From here to here is the joint capsule. The joint capsule is a fibrous structure that surrounds and encloses the joints. See how it encloses the joints here by the ways. So the joint capsule has this function of covering the joint and helps retain synovial fluid produced in the joint. Look at the synovial fluid. This is synovial fluid that enables movement. So this joint capsule helps it to be retained and closes the what? The joint. Another thing is that the joint capsule also ensures stability. It helps in ensuring stability of the joint. Now, another structure in the joint is the synovial fluid. The synovial fluid. The synovial fluid is viscous, it's a viscous fluid secreted by the synovial membrane. Look at the synovial membrane here. Synovial membrane is found here, and is the one that secretes this fluid. Okay, it's the one that secretes this fluid, and this fluid helps to fill this space, preventing friction. It also lubricates the joint. It lubricates the joint. As such, reduces friction, like we said earlier. Also, it has nutrients. It provides nutrients and oxygen to all these articular cells here, all this articular tissue. So, because these tissues here do not have direct blood supply. And that is why in osteoarthritis, when all of these are destroyed, you see a lot of formations, damages that are being formed here, making here very rough, and the destruction of the shape of the joint. That is why when we introduce this section, we told you the likely things you are going to see: destruction of articular surfaces, bone remodeling, and changing of the structure of the joint. You see that these joints will change because all of these are not destroyed because of the osteoarthritis. Then also this fluid also contributes to shock absorption because it cushions the effect of pressure. As such, protecting the joint from friction. The next is the synovial membrane. Synovial lining is found here. And like we said, the synovial membrane lines the inner surface of the joint capsule. Look at this, the joint capsule. Like look at the synovial membrane here. This one is synovial membrane. Synovial is the one that produces synovial fluid. Its major function is to produce this synovial fluid. Then it also creates barrier and protects the joint from infection and injury. Now, the next is ligaments. Ligaments are strong bands of connective tissues that connect bones to other bones. Now, look at this bone. It is this ligament that connects it to this bone, whereas tendons connect muscles to the bone, but ligament connects bones to bone. So what is the function of the ligament? Joint stability. It contributes to joint being stable. It supports movement by allowing for control movement of that joint. So these are the structures found in an ideal joint and in a healthy joint. But however, in osteoarthritis, there is destruction of all of this, and which leads to what we earlier said, loss of focal articular cartilages, subcorrendous osteosclerosis, osteophyte formation at the joint margin, and remodeling of the joint contour. The joint shape is changed because of the destructions that happen in this joint. Now let's look at the epidemiology of osteoarthritis. The prevalence of osteoarthritis rises progressively when someone is getting older. It has been estimated that 45% of all people develop knee osteoarthritis, OA, while 25% develop hip osteoarthritis, more common among women, at some point during their life. OA, like we said earlier, is a very complex disorder which has both genetic and environmental components. What we're trying to say is that this osteoarthritis has genetic basis. The actual cause has some degree of gene related, and then environment can also precipitate the condition. That's what we're trying to look at. Osteoarthritis has a component of multiple epiphyseal dysplasia, which are caused by mutations in the genes that encode component of cartilage matrix. The actual problem is that the cartilage that is the major substance that form the articular tissues becomes abnormal. Becomes what? Abnormal. And it has a trace that it has gene origin. That is a particular problem that has to do with the gene that gives the information for the production of this particular cartilaginous matrix. So once the gene is faulty, it will be sending a wrong information on the production of abnormal cartilaginous matrix. Family-based studies have estimated that the hereditary or the heritability of osteoarthritis ranges about 43% at the knee to between 60% and 65% at the hip. So there's full evidence that osteoarthritis has to do with the gene of the person, the type of gene the person inherited. At some point in life, there's mutation that leads to production of a abnormal matrix. Because when the matrix of the cartilage is abnormal, it means that the cartilage will not be that quality cartilage that does the function it's supposed to do. Another thing about osteoarthritis is that it has to do with structural abnormalities. It has to do with structural abnormalities. Evidence have shown that people who had conditions like slipped femoral epiphysis, also known as slip central femoral epiphysis, SCFE, which is a condition that is known by the displacement of the femoral head. Like this, when someone in life have had this condition whereby the head of the femur is displaced from this area, that the person in later life will likely develop osteoarthritis. That's what we're trying to say. People who have structural abnormalities in the past are at higher risk of coming down with osteoarthritis later in their life. Slipped femoral epiphysis is a condition characterized by the displacement of the femoral head. That is this ball portion of the femur from this particular hollow space for it. Okay, so when someone had this condition in before, the person can or may likely come down with this osteoarthritis later in life. However, the exact cause of this SCFE is not completely understood, but it is believed to involve a combination of mechanical and hormonal factors. Okay, so when a person has this structural abnormality, the person has a higher chances of coming down with osteoarthritis. Another structural abnormalities that if someone had it in life, the person might likely come down with osteoarthritis is this condition known as the Paget disease. The Paget disease is a disease of the bone. It is a chronic disorder that disrupts the normal cycle of bone remodeling. You know, when bone does what's called remodeling and resorption. That is the process of breaking down a particular bone and forming a new bone. This, when a person has Paget disease, it leads to enlarged and weakened bone, which cause pain, deformity, and increased risk of what? Fracture. However, study says that the exact cause of Paget disease is not fully understood, but it is thought to involve combination of genetic factors and environmental influence. Some studies suggest that it is due to viral infection, that the viral infection might actually be the trigger, such as measles virus. And now let's look at this Paget disease briefly. This disease is characterized by an increased osteoclastic activity, which is those cells that break down, which is responsible for breaking down bone cells. This is now followed by compensatory increase in osteoblastic activity, that's formation, which leads to formation of new bone. However, the newly formed bone is often structurally disorganized and weaker compared to the normal one that was already destroyed. And the person begins to have bone pain, deformities such as bow leg, increased warmth, fracture resulting from weakened bone. So if someone has have developed this condition before, this spaghetti, the person has a higher chances of having osteoarthritis later in life. So when we are looking at the actual cause of osteoarthritis, we look at genetic basis, which affects the actual formation of the bone matrix by the cells, the cells that are responsible. Then we look at the structural abnormalities like the Paget disease and the SCFE condition. If you look at all of them, they have genetic component as well. So when someone have come down with this condition, the person is likely to develop osteoarthritis later in life. So this is a Paget disease affecting the bone. Another factor we must also look at is the biomedical factors. And what are biomedical factors? Biomedical factors, like we said, refers to the biological and physiological conditions that influence health, disease, and overall functioning. So when we look at biomedical factors, we try to look everything in holistic, try to look at everything holistically. And when we have this understanding about biomedical factors, we will now be able to understand how it relates with other genetic and having the conditions, other structural abnormalities in place. Okay. Now, when we talk about biomedical factors, like we said, it has to do with the biological and physiological conditions that influence health, disease, and overall function of a human being or human body. These factors include, but not limited to, genetic for health. When we look at genetic factors, look at the inherited trait of the person. Some person inherited a particular trait that's responsible for the formation of abdominal matrix. Then we look at having some other conditions. We look at biochemical factors such as metabolic processes and metabolic pathways, breaking down of molecules and anabolic processes too. We look at hormones. Hormones contribute. Like when we're looking at SCFE, we talk about hormones also contribute to that condition. We look at enzymatic activities, the presence and functions of enzymes that catalyze biochemical reactions can influence the coming down of this condition. Then we look at immune functions. How do the immunity contribute? If you look at it, it could be that the immunity is overreacting that lead to destruction of the normal cells. Then we look at microbiological factors as well. Like when we look at the Paget disease, they said that a viral infection like measles can contribute to it. So when we understand the biomedical factors, we cannot say biomedical factors can actually contribute to the development of osteoarthritis. And also that biomedical factors, we look at environmental factors, such as the air quality, the water quality, toxins, nutrients, and lifestyle. All these contribute to the development of arthritis. Somebody that is exposed to excessive weight bearing, they likely come down to osteoarthritis. So that is very, very important if we understand this critically. Now, like when we are looking at the biomedical factors, we made mention of hormones. It's also been proven that estrogen appears to play a critical role because it lowers the rate of osteoarthritis, having been observed in some studies that women who use replacement therapies and women who receive aromatase inhibitor therapy for breast cancer often experience a flare in symptoms of osteoarthritis. osteoarthritis. All of these are incorporated under biomedical factors. So the factors that contribute to development of osteoarthritis include: one, genetic factors. Two, structural abnormalities. Three, biomedical factors. Now let's look at the pathophysiology of this osteoarthritis. What actually happens in an osteoarthritis? One, like I said, that osteoarthritis is a degenerative condition of the articular surfaces. So what are these articular surfaces? Articular cartilage. I know that the classical diagnosis of OA is the destruction of articular cartilage. Remember, under normal circumstances, the chondrocytes are the cells that produce the cartilage matrix, and that cartilage matrix is what gives it its tensile strength it has. But in an OA patient, these chondrocytes start dividing to produce nest of metabolically active cells. At the initial stage, the matrix components are produced by these cells at an increased rate. But at the same time, there is accelerated degradation, that destruction of the major structural component of that cartilage matrix. That substance that gives it that tensile strength is being destroyed as the chondrocytes are producing this cartilaginous matrix. There is increased destruction of the major component that is necessary for the cartilaginous matrix. And some of these components include the aggrecan and the type 2 collagen. These two and others are very, very necessary to give the cartilage its tensile strength. Eventually, the concentration of the aggrecan in the cartilaginous matrix will now fail, which makes the cartilage vulnerable to load-bearing injury because it has lacked the quality that gives it tensile strength. So when there's a heavy load-bearing, the cartilage undergoes a serious tear. And this tearing of the cartilage occurs leads to the development of a deep vertical cleft with localized chondrocyte death. That is the death of the chondrocytes and subsequent decrease and subsequent decrease decrease in cartilaginous thickness. So this initial focal loss or decrease will gradually now lead to overall destruction of the cartilage surface. Thereafter, once there's destruction of this cartilaginous surface, calcium pyrophosphate and basic calcium phosphate crystals are then deposited in that abnormal cartilage, which has already undergone some level of death and been destroyed. Then this calcium pyrophosphate and the calcium phosphate crystals are then deposited in the abnormal cartilage. Another thing that happens is that fibrocartilage is produced at the joint margin, which undergoes endochondral ossification to form osteophyte. You now recall. So, and this is very wrong. So the formation of this fibrocartilage, which is not a good cartilage, leads to formation of osteophytes. And then bone remodeling and cartilage thinning slowly alter the shape of that joint and increasing the surface area. So that is what happens in osteoarthritic joint. So that is the brief pathophysiology process that occurs in osteoarthritis. Look at this picture here. Look at this articular surface. It's already undergone the damage. And these are the These are the osteophytes. The osteophytes are now forming, and the articular surface is already what? Damaged. So osteochondral bodies commonly occur within the synovium, reflecting chondroidal metaplasia or secondary uptake and growth of damaged cartilage fragments. You see, that's what's happening here. The outer capsule also thickens and contracts, usually retaining the stability of the remodeling joint. And this joint will take a different shape because of formation of this fibrocartilage, which is now produced at the joint margin, will now undergo endochondral ossification to solidify to form an osteophyte, which is not ideal. Osteoarthritis has a characteristic distribution. Now we're looking at the clinical features. It mainly affects the phalangeal joints. That is, it affects the joints at the fingers and the toes. Call it proximal interphalangeal joints and distal interphalangeal joints of the hand, and the knees and the hip. It also affects the neck and the lumbar spine. And the main presenting symptom among patients are pain and functional restriction. They are unable to move that particular joint as it gives them intense pain. The cause of the pain in osteoarthritis are not completely understood, but findings suggest that it's due to increased pressure in the subchondral bone, mainly causing night pain. Another reason for the pain is trabecular microfractures. Fractures are going, remember the surface is already damaged. They are no longer smooth movements. It can lead to microfractures within the trabecula. Then capsular distension and low-grade synovitis. The synovium will inflame, and once there's inflammation, there is pain. And the pain may also result from bursitis because the whole joint is already affected. The synovium may be affected. The bursitis, the bursa may also be affected. Let's go back to our ideal joint. Now, the bursa here may be affected because everything here has been destroyed and being replaced by abnormal osteophytes remodeling. So the synovium gets inflamed and the person feels severe pain. This bursa gets inflamed and leads to pain. This joint is meeting with this joint, leading to subchondral pain here. The person feels a severe pain in the bone. So that is the cause of the pain the patient feels when they have osteoarthritis. Look at it. This is abnormal now. And other clinical features is restricted movement due to capsular thickening or blocking by osteophytes. Sometimes audible coarse scriptus. You will hear some sounds, a screeching sound, indicating that there is rough articular surface. The former smooth articular surface is now rough, and the bone articular surface are now rubbing against each other. You'll be hearing a crispy sound that is audible. Then bone swelling around the joint margin because it's inflamed. Deformity, the bone loses its shape. And the person loses stability. Remember, these structures, like we said, contribute to the stability of the joint. Now that they are infected and destroyed, they lost stability and are now unstable. Then muscle weakness and wasting. Yes, muscle will, because there's a force that's maintained by the ligament against the tendon to keep the joint in a particular neutral position. So once there's a damage, there is weakness, muscle weaknesses and wasting. Then there may be mild or absent synovitis, inflammation of the synovium. Now let's look at the characteristic of pain in an osteoarthritis. When a patient has osteoarthritis, the pain is usually insidious. And when we say the pain is insidious, we mean that the pain starts and lasts for over months or years. It starts gradually and the pain lasts much longer. Then there could be variable or intermittent nature over time. Sometimes the person will not feel the pain. Sometimes the person is really feeling the pain. Then, and the pain is worst when the person moves or when the person carries weight. But when the person is resting, the pain is relieved. That is telling you, because remember the bone, the epiphyseal bone distribute the weight along the bone in the joint. So as the articular surface is already damaged, once the person tries to walk, the pain is much. And once the person is doing any heavy lifting, the pains will actually be worse. But when the person is resting, the pain will disappear. Then our early morning, about 15 minutes, there could be stiffness after resting. Another character of pain in the OA is that usually one or few joints are painful. Management of osteoarthritis. The therapeutic aim of managing it as healthcare workers is one, to educate the patient about their disease, that this disease is chronic, it may not be cured. Rather, you manage it. Then, to control the pain, the essence is for you to control the pain. In terms of educating the patient, try to tell the person what the condition is all about and how the person can make it easier and how the person can relieve the pain. Then, to ensure that the person at least does activities of daily living, that can walk around and all of that. Then another aim of managing the OA is to modify the disease process where it's possible. And lastly, to identify and treat other conditions existing, comorbidity. Now let's look at the education part, management of OA through education. It is important to educate the patient about their condition and the treatment options they require, and also the type of lifestyle modification they need to adopt in order to improve their symptom. You need to tell them heavy lifting is no longer for you. Taking a long distance walk is no longer for you. Running, athletics, because it will worsen the symptom. So it is important to let the patient know how this disease process occurs and the importance of managing their weight and those activities they should implement in order to protect their joints from having issues. Then you can also, because you remember that there's muscle weaknesses and wasting. So this person should be taught on how to actually engage in certain exercise that will help the muscles around the joints. Then another thing is aerobic conditioning. When we say aerobic conditioning, it means engaging in cardiovascular exercise to enhance overall stamina, heart health, and to promote weight loss and maintenance. For example, a 60-year-old woman with new osteoarthritis is encouraged to participate in low-impact aerobic activities such as swimming, cycling for 30 minutes, 3 times in the week. This will help improve our cardiovascular fitness in the heart without putting excessive strain on her knees. The next is muscle strengthening. Remember, muscle weakness are among the characteristics of osteoarthritis. The person can engage in exercises that are focused on building the muscle strength around that joint in order to enhance the stability and support of that joint. For example, you can engage the physical therapist who designs a strength training program for patients with chronic low back pain. And this will help build the muscles, reduce the strain on the lumbar spine. Then we give simple analgesics such as paracetamol to alleviate pain and fever. Then we can also give NSAIDs, anti-inflammatory drug, non-steroidal anti-inflammatory drugs, NSAIDs, so that's ibuprofen if the person doesn't have an ulcer. Then other drugs can also be given, such as a disease-modifying therapy. Under this option, that drugs will known as the DMT, disease-modifying therapies, such as methotrexate. And that drug helps to reducing inflammation and also prevents long-term damage to joints. Then reduction of adverse mechanical factors. It's important to address physical aspect or conditions that may worsen the patient's symptoms or impair function. It's important. For example, an individual with flat feet is provided with specific exercise. This will help to reduce mechanical stress on their knees and hip. Pacing of activity. It's important to structurally a daily activity to avoid fatigue and overexertion, which can worsen symptoms. So if you give the patient some task, the person takes it beat by beat. Then you have an exercise for that patient, you take it beat by beat in order to prevent flare-ups. Then appropriate footwear. Wearing shoes designed to provide proper support, cushioning, and alignment to reduce the risk of musculoskeletal problem is ideal. And then lastly, weight reduction. If the person is obese, it is important to encourage weight loss in order to reduce the excess weight, because this might contribute to exacerbation of this OA as the patient's weight is increasing. Pharmacologic treatment. The drug of choice include analgesics, paracetamol, some other higher drugs, but for primary healthcare facilities, analgesics are paracetamol and oral NSAIDs are usually recommended. You're not allowed to use drugs that are disease modifying at that level. So that will be all for the discussion on osteoarthritis. Do well to stay with us. In the next section, we shall be looking at rheumatoid arthritis, septic arthritis, and other forms of arthritis. Thank you for joining this section.